Good day everyone, my name is Daphne Biol from Babesia Census 3A. So for today, we will be discussing about Babesia microti organism. Babesia is a disease caused by microscopic parasites that infect red blood cells and are spread by certain ticks. In the United States, tick-borne transmission is common in particular regions and seasons. It mainly occurs in parts of the Northeast and upper Midwest and usually peaks during the warm months. So, Babesia microti is caused by microscopic parasites that infect red blood cells and are spread by certain ticks or spots. Then, this Babesia microti is na siya season nga mudagsa. Usually di siya mudagsa isa warm months. So, Babesia microti is spread by exoscapularis ticks, which are commonly called black-lead ticks or deer ticks. The parasites typically spread by the young nymph stage of the tick. Nymphs are mostly found during warm months, spring and summer, in areas with woods, brush, or grass. And other possible ways of becoming infected by Babesia include receipt of a contaminated blood transfusion, then transmission from an infected mother to her baby during pregnancy or delivery. Further explanation about Babesia microti, it is called as exoscapularis ticks, or what commonly called as black-lead ticks or deer ticks. Then, as what I say earlier, that Babesia microti is found mostly in warm months. Then, makita siya sa woods, brush, or grass. Then, morning duha ka possible ways that infected by Babesia include receipt of contaminated blood transfusion. So, for instance, transfer ka og blood sa another person, then ikaw is naa ka ay Babesia microti infected ka ana, then kato imuhang na-transmitan ma-transfer dito or ma-infect po to siya og apil. Then next is transmission from an infected mother to her baby during pregnancy or delivery. So if you are pregnant, then you are infected of Babesia microti, then affected imong baby na sulod sa imong tummy. So mo nga picture example. Muna siya ang parasite nga naga-infect og Babesia microti. Then kaning nasa right is muna siya ang forma kung naa kaani, like mga spot. Then ma-spread ni siya in a certain ticks. Ticks is kanang mga mark or spots parehas ani nasa picture. Next is the complications. So these are the complication about Babesia microti. First is very low blood pressure. So it means anemic, low imuhang blood pressure. Then liver problems, breakdown of red blood cells known as hemolytic anemia. Then kidney failure and heart failure. Kaning Babesia microti is most cases occur in the Northeast and upper Midwest, particularly in parts of New England, New York State, New Jersey, Wisconsin, and Minnesota. In the Northeast, Babesia occurs both in inland and coastal areas, including offshore island. So it's common lang siya sa Northeast and Upper Midwest, and wala ko kabalo if naba siya sa Philippines, or I think rare lang siya siguro dito sa Philippines, pero mostly dito sa Northeast and Upper Midwest nga mga lugar. So, symptoms and the signs of Babesia infection. Many people who are infected with Babesia microti feel fine and do not have any symptoms. Some people develop flu-like symptoms such as fever, chills, sweats, headache, body aches, loss of appetite, nausea, or fatigue. Because Babesia parasites infect red blood cells, Babesias can cause hemolytic anemia. So, Babesias can be a severe, life-threatening disease, particularly in people who do not have sleep and have a weak immune system for other reasons such as cancer, lymphoma, or AIDS, and are elderly. So, kani siya is na siya asymptomatic like siya sa virus karon na COVID nga positive ka pero asymptomatic ka wala nakakuyaw ani nga microorganism. Then, mostly siya ga-occur katong tao nga do not have sleepen. So, katong dili kayo sigig bilar, weak yung immune system. Then kaning kuan, na cancer, lymphoma, or AIDS. Then, kato na yung kuan, mga tiguang na siya. Like, dali ra sila matabtan og sakit tungod kay hinay na ilang immune system weak na kaayo mo fight sa mga ingani nga mga sakit. Pero siya sa virus COVID-19. Dili na kayo kasukol ilang lawas katong mga elderly or mga guwang-guwang na jud siya. So, mao ni siya ang life cycle sa Babesia microti. So, the Babesia microti life cycle involves two hosts which include a rodent, primarily the white-footed mouse. As we can see in the picture, first is tick takes a blood meal. Primarily the white-footed mouse, Peromysicus, leucopus, and a tick in the genus Exudes. So, gasugod gid siya sa tick or mga spot. Then, second, as we can see in the picture, during a blood meal, a Babesia-infected tick introduces sporozoites into the mouse host. Sporozoites enter enterocytes and undergo asexual reproduction or budding. So, asexual is dili siya kuan og intercourse, sex intercourse. Then next, in the blood, some parasites differentiate into male and female gametes, although they cannot be distinguished by light microscopy. So, there na siya ga-produce and male and female gametes. So, the next will be the number 4. The definitive host is the tick, once ingested by an appropriate tick. Then, as we can see in the picture, number 5, gametes unite and undergo a sporogenic cycle resulting in sporozoites. So, first is fertilization in gut, then leucinate enters salivary gland, then sporogeny, then it produces sporozoites. Transvarial transmission, also known as vertical or hereditary transmission, has been documented for large Babesia species but not for the small. Babesia such as Babesia microti, humans enter the cycle when bitten by infected ticks. During blood meal, a Babesia-infected tick introduces sporozoites into the human host. Then, next is number 7. Sporozoites enter erythrocytes and undergo asexual replication, or what we call as budding. Then, lastly, multiplication of the blood stage parasites is responsible for the clinical manifestations of the diseases. Humans usually are dead end hosts. However, human-to-human transmission is well recognized to occur via contaminated blood transfusion. So, mao to siya ang life cycle sa Babesia microti. The laboratory diagnosis. The clinical manifestations and the signs observed in cases of Babesias are not pathognomonic and hence for definitive diagnosis and appropriate treatment. Microbiological identification is necessary. Various methods have been employed for the identification of this parasitic infection, that is microscopic detection, culture, serological test, and molecular techniques. So the treatment is not all people with Babesia infection will require treatment. Babesias can be asymptomatic, and usually in these cases, doctors will not suggest treatment. If a person does have symptoms or asymptomatic but at risk of severe infection for other chronic health reasons, a doctor may recommend treatment. So, pares akong gingon ganina nga, pares na siya sa virus nga na-asymptomatic and symptomatic. In addition to these medications to treat the infection, a doctor may prescribe supportive medication and therapies. First is the blood transfusion. Next will be the fever-reducing medications, hemodialysis to filter the blood, drugs to increase blood pressure. So, mao ni siya ang mga medication and therapies if grabe na gid kaayo ang pagkalat sa Babesia microti. And that would be all, guys. Thank you for listening. Bye. Keep safe all.